Welcome, everyone. Today is Tuesday, December 1st, 2020. This is a work session for the Pitkin County Board of County Commissioners. My name is Patty Clapper. I am in the board meeting room along with staff members, and we have on our Zoom meetings, we have Commissioner Kelly McNicholas Curry, George Newman, Greg Poshman, and Steve Child, who is chairman, and I'm going to turn the meeting over to Steve now. Steve, it's all yours.
Thank you, Patty. Welcome, everybody, and welcome our different guests I see on the screen. Gabe Muthing from the Aspen Ambulance District and Dave Ressler from Aspen Valley Hospital. So our first thing on the agenda today is the Ambulance District 2021 proposed budget. And Connie Baker, I'll hand it over to you.
Yes, good afternoon, everyone. We're here to present the ambulance district budget. And we're going to start out the meeting today with Aspen Valley Hospital and Gabe Muthing of the ambulance district. And they have a little presentation to give you first. And then we'll look at the county's 2021 budget and 5-year plan for the ambulance district. So I'll hand it off to you, Gabe and Dave.
Great, I'll go ahead and just make a few prefacing comments about this multiple decades long relationship that we have had that many of you are very familiar with between Aspen Valley Hospital and the Aspen Ambulance District. And that relationship is basically one that has been mutually beneficial and but ultimately I think has well served the community extraordinarily well over the years, and that is the hospital provides the management of the services. And so we hire the very well qualified and talented director, in this case Gabe Muthing, for a number of years now, who's really going to get into some of the meat of the budget. But I just wanted to make some prefacing comments about the value of this relationship and the services that are subsequently provided to the community. And that's because we have created an ambulance service here in Aspen that is superior to that which other small communities, much less large communities, can look toward, and that is because we have the ability to interrelate the clinical services of the hospital with those of the ambulance staff. And so we work as one. And so a patient's experience oftentimes starts pre-hospital. And so having that relationship to assure that we connect all the dots and provide a seamless level of care for the patient to be treated out in the field by expert paramedics and pre-hospital professionals and then brought here is really important. And Gabe can talk a little bit more about how their training, critical care expertise, and other capabilities far exceed what is typical. The other point I want to make is that it serves our hospital patients very well as well, because it assures us of having the ability to transport patients from here by ground to other facilities when need be, and in all kinds of weather and conditions. And we have critical care paramedics here that we are very assured of having the best possible care for our patients while en route. And that's a big deal. That's a really important component of our hospital's ability to make sure that our patients get to where they need to go safely and in the best conditions. So I'm very pleased to be able to continue this relationship with you as the board of the ambulance district, and look forward to any questions you might have. With that, I'll turn it over to Gabe to talk about the specifics of the budgeting process.
Thanks, Dave, and thank you all. I certainly have to throw out a thank you to the Board of County Commissioners for an amazing job throughout this year. I got to see in the early days of COVID, got to see some amazing teamwork among the BOCC and the incident management team and our service as well. So I'm just so very proud of this community. I realize it's been a rough year, but certainly proud to be a part of this. First off, I really just kind of want to talk about operations over the past year and how those have changed, and again, how it will impact the budget in 2021. First and foremost, as you can imagine, March 8th of 2020, we had a dramatic change in our community. Obviously, everybody knows that. With the ambulance service itself, overnight, we literally made safety changes that we never thought we would make. Overnight, we had changes in our volume, when that volume was coming in, how many calls were coming in, at what time of the day and night. Everything just seemed to be exactly the opposite of what normal was. We were being asked to transport patients, or at least to go to a patient's home on a 911 call, and then asked to evaluate them there and determine their level of need, whether they needed a hospital, whether they needed to stay at home. We were providing assessment remotely for physicians in the hospital, and then either leaving a patient in their home with good directions to move on, or to care for themselves, or we were bringing them to the hospital. Something that we normally do, obviously, is to go see patients and not necessarily take them to the hospital, but we were doing this at much higher levels than we were normally, and doing it in a very different environment. Trying to do assessments on patients through some of the PPE, the personal protective equipment, was just certainly a new task for us to develop. We certainly saw the way that we operated. Normally, when we go on a 911 call, we have a huge amount of help from our community. We have police officers that show up. We have fire department officials that show up. We have, various other agencies here in the valley that help us on calls. Overnight, we literally saw a very different response model in which all of those other agencies created a perimeter around the call. And then we would send our folks in fully gowned up, geared up in PPE to deal specifically with a COVID patient. And of course, the scare is always whether or not the patients that we're seeing actually have COVID or not. At this point, everyone is assumed to have COVID, even if they have no symptoms, or if they have symptoms of something else. Until proven otherwise, we treat them as a COVID patient. So we've changed things dramatically, just on the operational side. And then, of course, as Dave alluded to, one of the things that I really hope that our community is so very proud of is the ability for us to take care of our community, not only through a 911 call, transporting them to the hospital, having a great continuum of care with Aspen Valley Hospital, with our paramedics working within the hospital itself. But then, if those patients need further higher level of care and need to be taken to another hospital in Denver or Grand Junction that can handle their care a little bit more appropriately, we're able to do those transports. In the early days of COVID, most of the flight services were not, the medical flight services were not taking COVID patients because they didn't quite know how to deal with the contagion in the aircraft itself. So we were taking those patients by ambulance. Dramatically different story when you're talking about being in full PPE and then putting yourself in a 6-by-6 foot box with that contagion for 4 or 5 hours at a time on our way to Denver. It sounds like something out of a Twilight Zone movie. Imagine, if you will, being in a 6-by-6 foot box with a contagion. So we dealt with that. The one reason that we're able to deal with that so effectively, efficiently, and quickly is that we already had that in place. And thanks to you and thanks to the district here, that's allowed us to have that level of care in our community, just unprecedented. There are very, very few places in the state, and only a couple here on the Western Slope that are actually able to handle doing this type of transport. All of this while still having to deal with normal EMS. The car wrecks didn't stop. The broken bones didn't stop. The injuries, the illnesses, you name it, it didn't stop. We just had that in addition to the complexities of COVID. And so certainly we dealt with all of that and kept that to a high level, as we always have. In a few seconds here, if you'll allow me, I do want to share my screen because I do want to show you a couple of things. And more than anything, I want you to be as proud of your EMS folks here in town as I am. But I want to show you a couple of pictures of what it looks like for us to do our job here. So I am going to, if you don't mind, I'm going to just share this real quick. Whoops, let's see if I can get to it. There we go. Just to give you an idea, this is what it looks like to do a COVID transport these days. Dramatically different than you've probably ever seen in the past. Normally we have smiling faces and paramedics in blue polos and blue work pants. This is the new normal. This is what it looks like. This is a full powered air purifying system. This is a full Tyvek suit. If you notice that the amount of gear and equipment needed to do one of these transports is just astronomical, right? This is nothing that you will see in a normal ambulance anywhere else, right? But we're able to do this because of the level of care that we have decided on as a community, that critical care level, and the fact that that about half of our paramedics are critically care trained. They're able to do this. They're able to put a patient on a ventilator. They're able to put a patient on multiple drips. They're able to deal with the sickest of the sick. Move a 6x6 foot box. Some of you may recognize this is Lisa Hicks, who has been a longtime paramedic of ours. Great paramedic, critical care paramedic. This is Randy Ice, who many of you may recognize. He's been with us since time began. But you can see we put patients on ventilators, we put patients on plenty of monitors, and have to do all of this in the new norm of looking through a powered helmet where we can't hear anything, we can barely see anything. And of course it takes more than a couple of people to put them in this gear. When they get ready for a transport, it takes an extra person just to help them get dressed and to make sure that they are able to handle the virus as if they were to come in contact with it. So this is not just an easy throw on a hard hat and go to work. This takes multiple people to get us ready to do so. And then of course, as I said, we certainly still do our normal activities. This was one of our rope rescue trainings that we were doing, and to do it in a mask, certainly hiking up hills, hiking through the mountains, hiking and jumping over a cliff. We still have to do that, absolutely. So wanted to make sure that you understand we're still at it. We're just taking a lot different precautions these days. Again, back to just the upper left-hand corner there is how we are responding to most calls now. We have all of our same equipment, but we now have a significant more PPE that we have to wear just on a normal call. And again, it takes extra people to help us get ready for that. So with that, I just wanted to show you just a little bit of what it looks like in our world. And keep in mind, all these folks are doing this, on a shift. And certainly, without a doubt, there's some fear in working with the, COVID that closely and in that confined a space, and yet they still come in day after day. I have an amazing staff that have amazing families that let them do that as well. So we've fared very well through this thus far, and are happy to provide that. Knowing some of that, just with our new budget, it's a fairly normal budget for us. We did reduce quite a bit of our supplies, knowing that a lot of what we're doing now is the same level of care. We're just doing a little bit less of it. People were a little bit safer this year. We did see some drops initially, obviously with ski season shortened in the early season. We saw some drops in volumes. So we have adjusted our budget accordingly, still running a very lean budget. The only changes this year are really for a couple of main things. The first being that this is the year that we will replace our cardiac monitors. Cardiac monitors are integral to what we do as a business every day. It allows us to monitor the cardiac rhythms of patients, also allows us to defibrillate them. So a very integral piece to what we do. We keep those monitors for 7 to 8 years, and then they're at the end of their useful life, which is where we are here in 2021. So that will start this budget year to be able to replace those, and we will be replacing those along with, and I'm sure Connie and Jeanette will explain that a little bit, but we walk that out for the next 5 years, I believe, pay for those over the next 5 years. We also were looking at some additional personal protective equipment, which, as you saw in some of those pictures, is absolutely integral to what we're doing. as you can imagine, not only are the transports certainly, needed, to have the PPE needed for that, but we also still need to do our normal job. So if you can imagine trying to crawl into a crashed car with broken glass and broken plastic and everything around you that can cut you and hurt you, and we're trying to do that in a paper gown and paper, barriers, doesn't work too well. So we are looking at a different type of PPE that will allow us to have a much safer working environment and make sure that we keep our paramedics safe, paramedics and EMTs safe as they do their normal job. This would just be a little bit less disposable model of PPE and move to this being the norm. So looking at that, and then also increasing a little bit of our staffing from a normal 10-hour day in the seasons to a 12-hour day, and making sure that we are able to span the need. Normally, we're able to look at our busiest times, and that busiest time is spread just a little bit. We want to make sure that we have full coverage and are able to answer every call. We can do that effectively and efficiently with some staffing, and really looking forward to making that change as well. So without further ado, unless you have any questions, I'm going to turn it over to Jeanette to talk a little bit about our budget, how we budget here at the hospital. And Jeanette, do you need me to show the form?
Yes, please. I was going to ask, do you have the budget in your PowerPoint?
I do. Let me see if I can't switch that over for you. There we go. You see that okay?
And hopefully everybody can see that. So let me just talk briefly about the format that you're seeing right now. Let me see if I can. I'm requesting remote control from you, Gabe, so they can see my pointer. Can you see me pointing? Great, perfect. So this is the budget for the ambulance district for next year. The way the spreadsheet is laid out is this is the budget for 2021. This is the budget that you approved for the 2020 year. This is our projection of what this year will end as. This is our comparison between our 2021 budget and a 2020 projection. And this variance that you see is going to be the 2021 budget compared to the 2020 budget. So based on the fact that we had COVID reduce the operations over at the ambulance district along with the hospital, I would like to focus on the projection. The one thing that I want to emphasize is in 2020, because of COVID, you will notice that we have a significant reduction in our charges, and we also have a reduction in expenses. So you had originally approved the 2020 budget for the ambulance district. The total funding for this district would have been $474,000. After COVID hit, and with a reduction in volumes, and as Gabe stated, the way in which we treat the patients at the ambulance district, the actual expected subsidy for this operation went from $473,000 to $626,000. So for the 2020 year, we are expecting that there will be an additional subsidy of $152,000. So I wanted to make that distinction because as we move forward to the 2021 budget, you will see that the increase, it's about a $36,000 increase in 2021 budget subsidy compared to the actual projected 2020. One thing that I want to make note is when we projected the volumes for 2021, you'll see that our charges are basically the same as 2020. This includes an increase in charges, but it also reflects an expected reduction on the volumes because of the skiing season. So we're projecting that there will be a lower number of transports that are actually billable transports during the season with the expected reduction in our volumes for the ski season. We kept the remainder of the year flat. So that's why you'll see that the revenues are basically flat. when you look at the budget to budget. But compared to the projected, we're expecting to be about 23-24% better than where we are. And right now, we are currently running through the third quarter for this year about 24% behind budget on charges. So that's basically the difference that you'll see. With regards to the expenses, we're also, as Gabe mentioned, there is an increase on the small furniture and fixtures and minor equipment, and you will see the depreciation is going up $50,000. So Aspen Valley Hospital, over the past 5 years, we bought the pulse oximeters for the ambulance district, and then we built the district to depreciation. Basically, we upfronted the cost and then had the district pay us back through depreciation. The cardiac monitor for next year, there actually is a $250,000 purchase that Aspen Valley Hospital is going to basically subsidize for the next 5 years. So we will build the district back via depreciation. So you'll see that that one line item alone accounts for $50,000 of the overage. So as the budget that is presented before you, we are basically presenting a $667,000 operation compared to a $626,000 projected for this year. To the extent that these patient revenues next year are higher than the district, of course, we'll see that reduction in the subsidy. Anything, Dave or the team, that you would like to add, or any questions that anyone may have on this information? I know it's a lot of numbers, but just want to make sure you're understanding the differences and the increases.
So I'd like to mention to the board that in your fourth quarter supplemental requests, which we will be reviewing after the ambulance district budget, there is also a request for 2020. You saw the difference on that last chart between the 2020 budget and the 2020 projected. So one of your fourth quarter supplemental requests is that difference of $152,000 for the 2020 budget.
George?
I just wanted to reference, the district has missed charges by $326,000 because of COVID. So the 152 is significantly reduced from the actual gross charges that were missed.
Yeah, Gabe, I noticed that you've substantially reduced the budget for special events. And I'm just curious, for 2021, I think we have a presentation tomorrow regarding the X Games. But as we're moving into the spring, the summer, next fall, with the hopes of having a vaccine and perhaps special events coming back online, you think you're going to have to come back with a supplemental budget if those things happen?
Great question. I would love to have the crystal ball to see what special events are going to look like. I really do hope they come back. I think they certainly are part of our community. As you said, we are in talks with X Games and ESPN right now, so we do believe that we'll be able to start off our season that way. Keep in mind, though, that all of our special events are done as a revenue, right? That's not a loss for us at all. That is a complete revenue side for us, which is why we've got it budgeted just a little bit lower, just not knowing what will come back. I do believe, though, that looking just in the future, and it's probably more of a public health question, as to how much is going to come back and at what scope and size. But I feel comfortable in the number that we put in there. Again, that's a revenue number. So in other words, if we are able to bring back special events more and we're able to provide it, we're still able to utilize, and we're still able to do so with the normal process that we use. So that number would potentially go up as a revenue source. If that makes sense.
Great, thank you.
You bet.
Any other comments or questions before I turn it over to Connie?
Don't see any. Go ahead.
Thank you so much.
Okay, I'm going to go ahead and share my screen and bring up the Ambulance District 2021 budget and 5-year plan. The budget that you saw for Aspen Valley Hospital includes all of their patient revenues, reimbursements from insurance, and then all of their ambulance costs. And then the bottom line is the net dollar amount that is covered by the ambulance district property tax. And so the total cost, the net cost that we pay to Aspen Valley Hospital is included in professional and technical services. That's most of this line item. We also have a couple other things in that category. But that's, as you can see, is the largest part of the ambulance district budget is that payment to Aspen Valley Hospital. And that's what provides the ambulance district service. So just so you know where that is in our budget and 5-year plan. As Jeanette mentioned, there was an increase in 2020. They had a large shortfall in revenues, but they also cut back on expenditures. However, they weren't able to make up for that full loss in revenues. So again, the fourth quarter supplemental request that you will review later on adds $152,000 to the professional services line for that payment to Aspen Valley Hospital in 2020. And then the budget remains fairly stable, not much of an increase from that projected amount going into 2021. Again, there are some few other items in this professional and technical services line, including the payment for the ambulance district share of 911 dispatch. But I'd like to go ahead and start back up at the top for 2021. On the revenue side of the ambulance district, we have the mill levy, the property tax, which is estimated to bring in about $1.4 million. Then we do have a grant budgeted. There is an ambulance that was scheduled to be replaced in 2020, but that ambulance purchase actually is going to happen in January of 2021. So we moved the purchase of $270,000 from 2020 over into 2021. There's a grant associated with that. We had anticipated receiving $90,000 in grant money to help with the purchase of that ambulance. We're actually going to receive $113,000. So that's a great help for this fund, that grant that Gabe applied for the ambulance purchase. There's some investment income that comes into the fund. And then once the ambulance has been replaced, there's the sale of the old ambulance, which brings in some revenue. So total revenue in our fund of a little over $1.5 million. Moving on down to our expenditures, you see some salary and wages. These are not ambulance district personnel or hospital personnel. This is our facilities staff and a little bit of their time budgeted to take care of the ambulance facilities, some of the maintenance and just routine work on that facility. Professional and technical services, we reviewed that already, the payment to Aspen Valley Hospital, payment to dispatch. Then property services includes utilities for the building and some custodial. Other services include charges for fleet and radio services and phones, some supplies. $12,000 budgeted for radio replacements. And then the $335,000 for vehicles includes the $270,000 ambulance that was originally in 2020, plus the replacement, a normally scheduled replacement of a pickup truck. Other expenditures includes the treasurer's fees for the collection of property taxes and overhead charges. So that's a total of $1.37 million in expenditures. We also have a transfer to the debt service fund. This is the debt service payment for the new ambulance building, about $443,000. Now this year, as a one-time only, we are asking for a transfer from the general fund of $102,132. And this is for the increase proposed by the ambulance district for additional PPE and also for an increase in staffing, as Gabe had mentioned. This is a one-time increase. You'll see on the ambulance district or the professional services that from 2021 to 2022 there's a drop. So we have only put in this additional cost for ambulance service in 2021, and then it will be reevaluated next year. So this is just a one-time transfer from the general fund. It leaves bottom line a fund balance of about $220,000 in the ambulance district fund. You will notice that on the years where we are replacing an ambulance, there's usually a deficit, spending down fund balance, and then a small surplus on the years where there's not a large ambulance purchase. Questions on the 2021 budget and 5-year plan?
Steve, I have a question.
Yeah, Patty?
Yeah, Connie, is there not a possibility of maybe some CARES Act funding or some funding grant opportunities for that $102,000?
So the ambulance district has put in a request for CARES Act funding, but not for staffing. It was for PPE and a couple of other items. If I can.
That comes up in our supplementals.
Yes.
We can just
Some
address.
capital equipment and also an ultra-terrain vehicle. These were some extras that will only be purchased if the ambulance receives that CARES Act funding.
So if that happens, then we get CARES Act money to help with the increased amount of PPEs that we need, which may then offset some of the other budget issues within the ambulance
Yes,
district budget.
so part of the CARES Act request was for items that will not be purchased unless the CARES Act money is received, but part of it is for PPE. And this PPE will then reduce the budgeted amount if we get the CARES Act
Great,
funding.
okay, thank you.
Questions on this budget?
So
I didn't-
I'm not seeing, the CARES Act money was my only question that I had, and you've answered that already.
So Steve, I have a comment.
Yeah, Patty?
Yeah, I just want to thank you, Gabe, and your whole crew and the hospital support system for what you guys do out there. I know what it takes, been there, done that. I know what it means, and I cannot even imagine in today's world what it's like out there. But I want to thank you and your staff. You guys sometimes do a great job against all odds, and this community really appreciates it.
Thank you, Patty. That means so much to me, and certainly I will absolutely pass that on to our crews. I cannot tell you how much they'll appreciate that. They are an amazing crew.
Yep, we thank them.
Greg?
Yeah, Gabe, I was just so taken by the photographs you showed earlier. I'm hoping that those could be shared with the local papers or something, you know, to show what it takes with regard to PPE and running the ambulance and what it takes to take care of people. I just think it's enlightening and sobering at the same time, and I would propose that be pushed out to the community so they see what it takes to keep people safe here. It never hurts to keep driving that point home even now. Thanks, and well done. It's great to see Randy Ice there, right in the middle of it.
He's always right in the middle of it. It's kind of funny.
Kelly?
Yeah, echoing Greg's statement a little bit, you know, I think for me, this has really shown in pretty sharp relief just the strain that COVID can put on our healthcare services. You know, here, just from a budget perspective, are needing to close a gap that's bigger than 50% of what this year's projected budget, you know, contribution from the county was. You know, which I think is pretty significant, and to give you guys the resources you need to provide the excellent service, but also accommodating for the reduction in revenue. So, you know, it's been a bit eye-opening, and, you know, I'll just thank you guys again for the challenges that the ambulance staff and the hospital staff are really working under right now.
Thank you. Thank you.
Gabe, I was curious how all of your staff is doing in terms of getting sick themselves. How many of them have been in quarantine? Have you been short-staffed sometimes, or have you been able to keep fully staffed?
Boy, I sure hope by answering this it doesn't jinx me, but we've actually done very well. I think part of that is certainly early on we enacted some very, very strict rules, you know, and how we operated. As you saw, the PPE, we took the, you know, the very extreme road from the beginning, just to make sure that we always kept our staff safe. We've kept that up. The nice thing is of course we have our, you know, a newer building where we're able to distance fairly well in the building. We're keeping our crews safe. I think they feel I don't know what you'd call it, a higher calling, I guess. They're doing the right things out of work as well, protecting themselves and their families, and I think overall we've done an excellent job of that. Overall, to answer your question, though, we've only had a couple of individuals that have been out on quarantine, and thus far only a couple of our individuals have actually had COVID. It is kind of interesting to note we did do the antibody testing at the hospital, where we antibody tested as many employees as we could, and the ambulance department came up as one of the highest, you know, for having COVID in the past, which to me just says that we really are in harm's way, right? We really are dealing with this on a day-to-day basis head on. But the fact that we've been able to stay so healthy, I think I'll attribute to our amazing staff again, and their ability to adhere to those rules. And as you saw in those pictures, you know, we're taking every precaution, where it takes a couple of people just to get dressed to go to work, doing things the right way as best we can. But thank you, and they're all doing very well. They really are. They are in great spirits, and I think they see them that they are really making a difference in this community, which again I'm so very proud of them.
Gabe, you have to be careful when you say it takes a couple of people to get them dressed to go to work. It could be taken out of context.
That's true. That's true.
Well, I would agree with Greg that, you know, your efforts should be highlighted to the community, and, you know, a special story in the paper. I think that would be well worth the effort for, you know, the good PR, and also a message to the community on how they can better take care of themselves just by taking the right precautions and you know, following the rules. It's the best way to stay safe.
Steve, I can't echo that enough. I think people sometimes don't realize all the downstream effects if they do get ill, right? They should take all the precautions, because if they do get COVID, they're not only affecting themselves, right? There are tons of healthcare workers, there are tons of other individuals that will affect them. And we want to make sure that, you know, our folks stay safe, and to do that means a healthy community. So agree with you 100%.
Okay, looking at this budget, Connie, there's no decision point now on this, is that right?
I do need the board's direction to move forward with this as proposed.
I'm good.
Well, yeah, I'm definitely good. George is good. Kelly's just sort of, there you go. That's more reaction, Kelly. We are all in favor, fully supportive of the ambulance district efforts. So thank you so much for coming today and presenting your budget and just some background information on what you've been up to for the last part of the year.
Steve, I do have
Thank you.
I have a quick logistics question or procedural question. Since we sit as the
Yeah.
board, for the ambulance district, is there anything more or necessary that we need to do as a board for the ambulance district?
I don't believe so. You will approve their budget at first reading tomorrow, along with the rest of the county
Okay.
funds.
Okay. I just got to thinking about the fact that we John Peacock's on. Maybe John knows?
Yeah, so the ambulance district is a dependent special district where the Board of Commissioners sits ex officio as the board of the ambulance district. So all that is to say, it's a fund of the counties and you get to approve that budget.
Okay, so we can just roll it into the budget approval. Okay, just wanted to make sure we
Correct.
weren't missing a step. Perfect. Thank you.
Okay, well, thanks Dave and Gabe and your staff people for being here today, and we need to move on to our supplemental requests, which some of that it has to do with the ambulance district also. So Connie, why don't you kick that off?
Thank you, guys.
Thank you.
Okay, so fourth quarter supplemental requests. We have quite a number of requests, so we'll try to move through them quickly, but also make sure that any questions the board have get answered today, as they'll be coming back in first reading tomorrow. So let's, would it help the board for me to share my screen and show the requests, or are you okay just following along in your packet?
I'm good just on my other computer screen here.
Well, if you could share it, it's not only for us, it could be for the public viewing as well.
Okay.
Yeah, that's true.
Okay. Hopefully you all can see my screen. The first supplemental request that we have is an economic development grant. And I think Kara is on the line to present this supplemental request.
Hi, everyone. So Kara Silvernagle in the manager's office. I believe we came to you at the end of October through Northwest COG. We were able to get an economic development assistance grant. And really the purpose of the grant was for COVID specific around how to support our businesses this winter. What we found in working with Snowmass Tourism, ACRA, ECO, City of Aspen, and the Salt Chamber is a desire for a coordinated winter campaign, visitor campaign. And so what we have done is created the group was already getting together prior to this grant, but was struggling with how to come up with concise and a collaborative campaign. And so through this grant, using Snowmass Tourism as taking the lead in this project, we've been able to take all the ideas of all the different entities and come up with one coordinated it's called the Healthy Winters campaign, and it is to fund a graphic designer and providing printing of all signage and also paid media out to specifically different third parties that typically target our visitor population, and keeping that so that campaign also being fed from the Pickens County Public Health to ensure that the 5 commitments, avoiding the 3 Cs, and the local mask mandates are really front and center in that messaging. So the team is moving forward with that campaign. The request before you is we will get that grant in 3 installments of $10,000 in each county, in each quarter through spring of 2021. But given the timeliness of this campaign, we will be pushing that money through Snowmass Tourism, who is coordinating it up front right now, and then we'll collect those grant funds on the back end as we can through Northwest COG for each quarter. And so with that, I'll leave it for any questions.
Thank you, Kara. Great job.
Yeah, I like these kind of supplemental requests where we're getting grant money and then spending it, so it ends up being 0 impact on our budget, but we're accomplishing some good things in the process. Okay, I don't see no hands coming up. Thank
Okay.
you, Kara.
Thanks, Kara.
Thank you, everyone.
The next supplemental request is in the Healthy Rivers and Streams Fund, and it's for the Robinson Diversion Modification Project. And Lisa McDonald is here to speak about the request.
Lisa, you're muted.
Great. Good afternoon, everyone. Lisa McDonald with the Healthy Rivers Program. In front of you today is a budget supplemental request for, as Connie mentioned, the Robinson Diversion Modification Project. The request is to appropriate grant funds that we received, 3 of them, 2 from the Colorado Water Conservation Board and 1 from Colorado Parks and Wildlife Board through their Fishing is Fun grant. There is also a line item to increase, there's also a request to increase our line item due to some unanticipated costs that we just came to light to understand about. We recently received our Army Corps permit about 2 weeks ago, and a part of that Army Corps requirement is to have a monitoring plan for a 5-year period, which is similar to what we did at the Whitewater Park as well. We also just recently met with the town of Basalt. We anticipate coming into the project or across Willets Lane behind the Aspen Basalt Mobile Home Park. And so they are requesting if there's damage to the sidewalk or anything like that, that we cover, obviously, any damage that happens there. So we went out and measured and kind of got an idea of what that might cost as well. So our Army Corps permit allows us to start work today. We anticipate getting into the river probably next week. We are currently drafting a press release. We have signage being printed at the Basalt, printing for inside and in the river and outside of the river over at the pedestrian access there, and we will do social ads ads on social media, the radio, and the newspaper as well. So it has taken a village to get this project going. I just wanted to let you know we have worked with the town of Basalt, Eagle County, FEMA, the Army Corps, 2 landowners, CDOT, and CPW. So we're anxious to get in the river and get the project rolling finally. So that's kind of it.
Steve, I have a comment.
Yeah, Patty.
Yeah, real quick, Lisa, I want to thank you for this multi-neighbor jurisdictional whatever effort. It's huge. For me, I mean, there's a lot of reasons this project is important, but I think for me, the primary fundamental reason is the public safety issue. There's been a lot of safety concerns at this, at this portion of the river. So I think the community as a whole, all of the river users will be very happy to see this moving forward. So if there's anything we can do to get the word out and help you out, let us know.
Great. Well, thanks, Patty.
Any other questions for Lisa?
Lisa, if you need any volunteers to go in a raft and test the waters, I think we'd all be willing. Greg?
Yeah, hi, thank you. When I first saw this, it appeared to me as if the budget was actually twice what was originally anticipated. And you know, if you're glancing over it, you might not see the nuance. If you could briefly just explain again how the expenditure increase went from 400 to 826. I just want to make sure that's clear to everybody, and that was the first question I had when I first looked at this the other day.
Yeah.
Right.
Or do you want me to take that?
I think
Okay.
and Connie might be able to explain it a little bit better, because I didn't understand either about appropriating the grant funding. So I think when we add that grant funding in, that increases the budget. It looks like it goes up. We had always anticipated about 800,000 on the project, but this kind of brings it into line, I think, a little bit more. But does that make sense, Connie?
Yeah, exactly. So of this increase, 256,000 is grant money that's being received. But that grant money has to be appropriated and added to the total expenditure cost. So it's just a matter of how it was budgeted. It was budgeted originally as a net cost rather than including the full appropriations from the grants when they were received. So that's the main part of the increase. And then the increase in the cost is 170,000. So a smaller percentage of it.
Okay, thank you. That does help.
All right, don't see any more questions, Lisa. Thank you so much for presenting, and glad the project is finally getting underway. I remember looking at the aerial photos of that and trying to follow the engineers on what, how the project should be done. So
Yeah, we've got some good footage out there, and we'll be doing little construction video updates, so I'll make sure to get those out to the board.
Okay, great. Thank you, Lisa. The next supplemental request is in the Public Health Fund, and it is for a Protect Our Neighbors grant. Again, one of the many grants that are a net zero cost to the county. And I think Jordana should be on the line to present this one.
Do we see her on there?
No.
Maybe Kelly's doing it?
If not, I can speak to it a little bit. So this Protect Our Neighbor grant was applied for a little bit earlier in the year, but we are now appropriating the funds for it. And there are two different parts to the grant. There is $50,000 for the planning part of the grant and $150,000 for the infrastructure. And a lot of the work that is involved in this grant is towards the Hispanic and Latinx community, and making sure that the communication efforts and the prevention efforts of public health meet the communication needs of this community. So there are, and I can't speak to it very well. I'm sorry that we don't have someone from public health to talk to it better. But it is addressing these different cross-cultural communication needs. Kelly, do you have anything to add to this?
I just wanted to mention I saw Lindsay Douglas come up. She's been pretty embedded in this project. Maybe she could speak to any programming questions that might come up.
Yeah, I can answer any questions. And just to go off what Connie started speaking about the project, we contracted with West Mountain Regional Health Alliance to hire a team of 5 individuals that are bilingual and bicultural who have gone out into the community and have interviewed 600 individuals, part of that Spanish-speaking community. And after those interviews, we identified some barriers that they've been experiencing, whether it's testing, access to resources, and identified different channels of communication that they seek to get their COVID-19 information. So now we are going through the process of purchasing media buys with different Spanish-speaking media channels to start pushing out the information that has been available but hasn't gotten to those individuals who probably need it the most. So I'm happy to answer any of their questions that come up.
So not seeing any questions, Lindsay. Looks like a great program. I think it's really great that you're able to do this. I'm really glad to have the outreach into the Latino community.
Okay, great. Thanks so much, Lindsay, for stepping in there. I appreciate that. And this grant actually is a net addition to the Public Health Fund because it does cover some staff time that's already budgeted. Okay, the next supplemental request that we have.
I don't think Steve can see me. Sorry, Steve, I think you were looking at your other screen. I'm going to just question. Thanks. Can you guys hear me okay? Want to make sure, okay. Was there any matching requirement for these funds? I'm sorry if I missed that, but, or is this, just an outright grant from the state?
It's an outright grant. We have no additional matching beyond those amounts.
Okay, great. And I really appreciate this, regardless of the program update too, because we haven't heard what's going on in this realm in a little while, but I'm thrilled that it's been undertaken, and yeah, forward to some feedback and updates in the future. Thank you, Lindsay.
Hi. Yes, hi, thank you. There actually was a small match portion, but it was already covered by existing salaries. We could just allocate staff time that are already working on this or other projects to it. So there is a match, but it doesn't affect the budget at all. It was already it's already included in existing salaries.
Thank you, Kelly.
Mm-hmm.
Okay, if there are no other questions.
Okay. Don't see any. Go ahead.
Okay, the next supplemental request is in the Human Services Fund, and it is for access and functional needs. Here again, we have another grant, and Matt McGaw should be on the line to present this request.
Yep, hello and good afternoon, everyone. I'm Matt McGaw with Pickens County Adult and Family Services. Today I was wanting to request to add to our human service budget. We did recently receive a grant from the Aspen Community Foundation for $30,000 to support our Access and Functional Needs Program, also known as AFN. Our Access and Functional Needs Program was set up in March as a result of the pandemic, and initially we were doing a lot of case management to help support people's needs that may be vulnerable during the pandemic, really trying to support community safety and helping remove barriers for people to quarantine or isolate if they need to. A lot of people have lost work or have to sit out of work for a 2-week period if they need to quarantine. Many of those people have lost income and have not been able to meet all of their own needs. So recently we did request $30,000 to help support families or individuals that may need specific things to meet their own needs. And so right now our case managers are helping people get access to food delivery or grocery delivery if they're needing to stay home. They're doing some assessing with people to see if there are financial needs that are unmet as a result of the pandemic. And these are some of the ways that we'd like to use these funds. There was no requirement for a match. This has been a really beneficial grant to support direct client benefits. And so that's how we plan to proceed with this. Questions?
Kelly?
Thanks, Matt. I appreciate you guys working with the foundation on this program. I'm wondering, just given the amount of contacts in quarantine and the case numbers we're seeing, how quickly do you guys expect to burn through this money?
It's a good question. You know, we recently received this, so we've been providing the case management since March, and the funds have just recently been received. I would say that this is something we had planned for about 6 months. And right now that's hard to gauge, but we'll see how this goes. And but that's hopefully, you know, what we would see is going into the new year here, that we would have some coverage there deep into the first part of the year.
Okay, thank you, appreciate it.
You know, a lot of the requests, if people aren't able to pay rent or certain bills, we do a little bit of an eligibility process for people. And we also just try to connect people with other resources in the community. So it's not all about using this funding, and some of it's our case management and the work that they do. These funds do not go to staff salary. Again, it just goes for direct client benefits. So it's in addition to our case management.
Other questions?
Thanks a lot, Megan. So it's interesting hearing what you're up to there.
Thank you.
Okay, if there are no other questions, we'll move on to the next supplemental. Thank you, Matt. The next request is the Supplemental Nutrition Program, also known as SNAP. And this is in the Human Services Fund and Economic Assistance. And Sam Lander-Casper should be on the line to speak to this request.
Good afternoon, everybody. Yeah, we are here today to request a supplemental for the Supplemental Nutrition Assistance Program. This is a federally funded program that provides food assistance benefits to low-income individuals and families here in Pitkin County. It is formerly known as food stamps, it was the colloquial term. And we are requesting the supplemental due to the increase in utilization that we've seen since the onset of COVID. The benefit issuance through that program has approximately tripled since April of 2020, which has led to increased spending above and beyond what we had originally anticipated. Fortunately, since it's federally funded, these funds come in and there's no cost to the county. It's actually bringing funding in that's going directly to our customers that are then spent locally here at our food suppliers here in the area. So we're just asking to adjust that to our anticipated spending in that program of approximately $925,000 at the end of the year.
Are there any questions on this supplemental request?
Kelly has a question.
Thanks, yeah. Has the eligibility for this program expanded in response to COVID by the federal government?
Over the course of the pandemic response, there have been various changes to the eligibility requirements. At this time, there currently are no changes. There is a waiver out right now to allow us to waive the required interview, but that's more around expanding our ability as a department to process the increased demand. Currently, there aren't any extensions of maximum benefit amounts or any other changes to eligibility. However, I do know that they passed additional funding to keep the program going federally. So there is good news there, and the program is going to continue as usual.
Thanks, Sam, appreciate it.
Mm-hmm.
Okay, don't see any other questions, Sam. Thanks for presenting this today. This is a great part of the farm program. I'm always glad to see the food assistance part of the farm program is so important to the community.
Hey, thank
Absolutely.
you.
Thank you.
Thank you, Sam. Next, we have another grant that's in the Human Services Fund, and this one is for $500,000. Nan should be on the line to present this, the ESG CV2 grant.
Hi, good afternoon, Nan Sundin, Human Services Director. As you all can see in the supplemental, we've been successful applying for CARES Act money that's coming in from HUD to DOLA, Department of Local Affairs, the Division of Homeless Initiatives, to prevent, prepare for, and to mitigate the impacts of COVID on the homeless. These are one-time monies, and this is our second grant with them. You may remember we got $70,000 from their COVID-1 release. So this is their COVID-2 release. So you can see that on the application and then the attachment, which shows the budget that I presented for the $500,000. The focus of this grant is to expand our street outreach, which is case management and services to those who are at the safe outdoor space or on the street. The second is for emergency temporary shelter, because we don't have an emergency congregate shelter this year. We will be using those funds to procure hotel rooms and or apartments to house the homeless through the winter and as long as we can. The third is a rapid rehousing component, and that's where we would use a part-time person really to be helping us identify strategies for finding housing for the homeless. Then there's the HMIS component. So you might remember HMIS is the Homeless Management Information System. It's a system that the entire state is using to count the homeless and count the services to the homeless and to justify the funding. And then we're able to take 7% admin fee for all of it. So that's a whopping $35,000. We would like to, and in addition to that, we just received $60,000 from the Colorado Health Foundation to help us support the safe outdoor space and street outreach. So that money in particular will be used for anything that we can't get reimbursed for from HUD. And there are regulations, and it's fairly complicated because it's a federal grant ultimately. We are going to be looking at outsourcing some of the case management, and I have a meeting with one of our partners next week to see if they're interested. They would need to follow some very rigorous expectations, so I'll be having that conversation with them. And I have had a second provider approach me with interest, so that's fantastic. Now we have actually people who want to subcontract with us to enhance our homeless services. I would like to use the rapid rehousing money and combine it with the administration money to create a housing contract manager, because the whole homeless project has gotten too big for me to run the department and run all of this. And the state has given me assurances that I could combine those funds
and have this person, it would be a 1-year temporary position, term limited, I think Connie says. And they would be creating a strategy for finding housing units to work with Catholic Charities to house people in rapid rehousing, and then also work on managing subcontracts, making sure that we're dotting our I's and crossing our T's, helping us make sure that all of our subcontracts are compliant with HUD regulations, and helping to build some of the community systems that we need to build around tracking through HMIS and case management, case review, kind of coordinating our system. So I think that's a full-time position for a year. If we are successful and we can demonstrate our success, we're likely to get more funding, or our partners will begin to get the funding. That's ultimately our goal, is that our nonprofit partners will have the confidence and the experience to apply for this funding in a year. Any questions?
Kelly?
Nan, your department's ability to get grants astounds me. It's wonderful. I do have a question. How does this interplay with the conversation we had with the Catholic Charities contract?
Yeah, thank you. Yeah, it's almost like every time I talk, we need a map of all of the grants, right? So what Kelly's asking about is a reminder that we got $178,000 in CV1, the supplemental, and that was for rapid rehousing. And through your guidance, we negotiated with Catholic Charities and with the Coalition for the Homeless for Catholic Charities to get that money. They are going to be hiring a full-time housing case manager to support placing people in housing for a year and doing the case management that's involved in that. So my position is more administrative, looking for opportunities, breaking barriers, looking at landlord incentives, and then working with Catholic Charities who will actually do the direct service.
And so is the temporary contract manager you're looking for they would oversee the implementation of those monies as well that we're sort of funneling through?
Yeah, at this point, the contract is direct with Catholic Charities, so they won't be overseeing it. They will be supporting it. Catholic Charities has long had a desire to have a presence in Pitkin, but they don't know us as well as they know Garfield. So we really need to help open doors for them.
Okay. Thank you so much, Nan, for being here. Don't see any more hands raising.
Okay, great. Thank you, Nan.
Thanks, Nan.
And just to confirm with the board, this is adding 1 FTE for a term limit of 1 year.
But it's funded through the grant.
Entirely funded through the grant, yes.
I like hearing that, thank you.
So Connie, will that show up in tomorrow's budget?
Yes, it will. Tomorrow.
Okay, thanks.
Yep. So our next supplemental request is Redstone Ranch road grading. Not sure if Brian Pettit is on the line or not.
Oh, there he is.
I am.
Hi, Brian.
Yeah. Hi. Hi, I'm Brian Pettit. I'm the Public Works Director for the county. And Redstone Ranch Acres is located up 133 just beyond Redstone as you head toward Marble. The roads in Redstone Ranch Acres are county roads, but the county never accepted them for maintenance. So to fill the gap, the community there formed a general improvement district, of which the Board of County Commissioners is the board. Most of their money that they generate is for snow removal, but periodically the roads there need extensive grading, and this year it needed grading. So the $1,000 that they allocate each year was not enough. They needed another $3,550 in order to pay the contractor to do that work. So this supplemental is to pull $3,550 out of their fund balance and pay for the grading. I will add, so I'm talking to this group extensively to try to increase their mill levy. They are cutting it close every year, and one of these years they're going to need additional funds. So this year we weren't able to get it done, but hopefully one time soon they will conduct their own vote to hopefully increase their mill.
Okay, any questions on this one?
Brian, the one big cost I could see would be if they have to replace their bridge. It's the one they go across the bridge, right?
Correct.
And if they have to do major repairs on that, that's gonna require a lot more money than they have available. And sooner or later, they will have to do something, I'm sure, to the bridge.
It's a matter of time, you're right, Steve.
Okay, great, thank you,
Hey,
Brian.
you have anything?
Okay, the
All right,
next.
thanks a lot, Brian.
The next supplemental request is for the ambulance district fund, and it's the payment to Aspen Valley Hospital. This is the one that we mentioned during the meeting on the 2021 ambulance district budget. The expenditures in 2020 for ambulance service are actually about $109,000 less than their budget. But because the revenues dropped off so much, about $262,000 less in revenue coming in, that creates a net additional cost of $152,000. We went over this a little earlier. Are there any questions that haven't already been answered?
Good, Connie.
Okay. The next supplemental is in the housing fund, and it is on the deed restricted housing program. I believe Rich Engelhardt is here to speak to this one.
Hey, thank you, Connie. Board of Commissioners, Rich Engelhardt, Deputy County Manager. As you see in your packet, this is a request for basically a loan from the general fund. As part of our deed restricted housing program, one of the caveats is that you have to be an employee in good standing. Lately, we've had a couple of changeovers with employees that were in our program. So this is happening prior to the first of the year, or else we would have waited and utilized the funding that the board allocates each year for us. But unfortunately, the closing on this is going to be towards the end of the month. And whenever we had written this on this particular unit, we talked about an employee possibly renting it back, but the attorney's office through Jane has worked with the employee. We have it lined up now so that the closing is on the date of departure. So in essence, what we're looking at is a general fund loan for the amount of $450,000, but as we see it right now, it's around $430,000, a little bit shy of that. That we'll need to go ahead and purchase the house back. Our thought is that once it's vacated, we'll do our walkthrough. We will turn this over to our broker, put it on the market, and then sell the property at market value, and then put those funds into the housing program that will then be utilized by future employees. This seems to make sense on this one. It's located off the beaten path a little ways. If it was much closer, say within walking distance to the bus, we may have thought about this a little bit differently, but as it stands right now, we think that the best move is to go ahead and put the money back into the budget and utilize it for future employment. So opportunities for recruiting. So with that, it's pretty straightforward, and would be happy to answer any questions you may have.
And just so the board knows, we have done a reverse of this supplemental in the 2021 budget. So the 2021 budget already includes the repayment from the housing fund to the general fund.
Hey, Rich, where's this property located? You said it's a little off the beaten path.
Yeah, George, it's up on Missouri Heights.
Yeah, okay. You recall that one of my concerns with this program initially was to ensure that we're purchasing properties or allowing people to purchase properties that sort of within a certain realm of an area. So just so these examples don't come up. You were fortunate this year that we've got a pretty strong market in real estate, but that fluctuates, and we could be stuck with a property that would be really difficult to really utilize. So I think it's just sort of a comment in terms of going forward, in terms of, again, ensuring that the dollars we're spending are within a vicinity that we know that if something goes south, that we'll be able to either utilize that property or recoup our investment.
Yeah, George, and thank you for that. I recall that was one of your caveats whenever this was being developed. The particular employee would drive down off the hill and then catch a bus. So it is doable. And I think you've hit on it. If the market wasn't as favorable right now to where we think that we could put some additional money in and maybe boost the fund, as you know, is hurting for some dollars. So this may be one of those that really made sense to go the other way. The two recent ones, we have purchased them and then put those back to use, renting those to employees. So, but your point's well taken, George. I do know that we've denied a couple actually that were just too far out. So that criteria is being adhered to.
Oh, great, thank you.
Okay, I don't see anything, any other hands?
Okay, great, thanks. Thank you, Rich.
Thank you, board. Thank you, Connie.
Okay, the next supplemental is for CARES Act funding. And Ann Driggers is on the line. Ann, do you want me to go through it, or do you want to speak to it first?
Why don't you go through it, Connie, and I'll just answer any questions as they come up.
Okay.
Thank you.
So with the CARES Act funding, as the board knows, earlier in the year, Pitkin County was successful in receiving a little over $1.5 million from the first round of CARES Act funding through the state. Now, the state requires counties to come up with an agreement on how they are going to share that funding with the municipalities within their boundaries. And we reached an agreement that Pitkin County would retain 55% of the CARES Act, and then the remaining 45% would be split out to Aspen, Snowmass Village, and Basalt based on their populations within Pitkin County. So the first part of this supplemental request is simply recording or appropriating into the budget that round one that was already received and the payments that were already made to the municipalities of about $686,000. So this was a big boost to Pitkin County, but also to our partnering municipalities, and all of us have used this in our initial response to COVID for Pitkin County, both through the public health and the human services funds. Now, Ann has put a lot of work into applying for a second round of CARES Act funding. As yet, we have not heard back what we will receive or how much we will receive. She has asked for the maximum amount possible. That amount would be, and I'm always forgetting, that would be about a little over $4 million total. And if we were to receive that full amount, of course, then we need to turn around and before the end of the year, pay out 45% of it to the municipalities. So this supplemental assumes that we are going to receive the full amount so that we can appropriate the full maximum potential payment to the municipalities, just in case that's what actually happens, that we would not go over budget. It would be there should we receive that amount of funding. Of course, what we will actually pay out to the municipalities will simply be the 45% of what we are granted. We had already assumed that we were going to receive $750,000. So part of that has already been built into our fund balance estimates, but the remainder of that has not yet. There are a few other pieces to this supplemental request. One is that with this second round of CARES Act funding, we would like to appropriate $500,000 for additional COVID testing. So that's one piece of it. And then there's also a part that's for the ambulance district. As we talked about earlier in the ambulance meeting, that they have requested some funding for some capital equipment, an ultra-terrain vehicle, and also PPE. And so this supplemental covers the whole gamut of all of these CARES Act requests, both the revenue and the expenditure part. Questions?
Don't see any questions.
Okay.
Oh, wait, I have a question for Ann. Ann, where the heck are you?
I'm just in my guest bedroom at home, but I'm pretending to be in Finland waiting for the Northern Lights.
It's a pretty cool background, I have to admit.
Kelly?
Yeah, I'll just offer, I tried to chase DOLA down on where our grant application is at, and I've been told that we'll get an update on Thursday when the CARES Act consortium group meets. So hoping for favorable information then, but nothing to report yet.
Okay, great, thanks. Okay, if there are no other questions, we'll move on to the next request. And that is for the bond refunding and issuance of new bonds. With interest rates at very low levels, Anne worked with our bond counsel and financial advisors, and there are two parts to this. One is the sales tax revenue bonds. These bonds were originally issued in order to help RAFTA with some capital projects, a maintenance facility and some bus acquisitions and a number of other things. The bonds have been refunded a couple of times. So the latest series was in 2010. So refunding these bonds now gives us a better interest rate on the payments, and that reduces the amount that RAFTA actually has to pay in. RAFTA's share of the 1% county transit sales tax is reduced every month by the amount of debt service on these revenue bonds. So this actually gives RAFTA some savings and is a much better deal. And then the other bond issue is $20 million in general obligation debt for open space and trails for acquisitions. And this was a very successful bond offering. It actually netted over $24 million. We received premiums on the bonds. And so this supplemental request simply records all of the different transactions of the refunding and the bond issuance, the issuance costs, and everything related to that. Any questions?
Connie, I would just
Connie,
add, these transactions already took place. We wanted to wait until they were completely done, so we had the exact cost of issuance and so forth. And so the budget supplemental is just recording those amounts in the budget, the actual as happened, as authorized by you in earlier resolutions.
Yep. Thank you, Ann.
So, Connie, my question is the revenue bonds were really just a couple weeks apart from the open space bond issue. Were these two tied together so they got the same rate, part of the same deal, or are they totally separate transactions?
They were separate.
I can speak to that. They're two separate transactions, but we have them close together so that we could realize some savings by working with bond counsel and our rating agency on the two issuances at the same time. So we kind of copied, a lot of the same information about the county that we had to prepare and statements and so forth. And so we realized some savings just in our work leading up to the actual issuances. And when the issuances take place, it's kind of there's a strategy developed by our municipal advisor and our underwriters, and they look and see what else is coming on the market and what it's for, who it is, and pick dates where they think that we can get the best prices. The sales tax bonds were slightly a higher interest rate than the open space and trails bonds, purely because the sales tax, which is repaying the debt service, is a more volatile revenue stream than property tax, which is considered to be more solid. And so that's the only difference between the rates. Both rates were thought to be extremely good for our issuances.
Okay, thanks, Sam. And I remember we were kind of talking about them at the same time, same conversations. That's why I was curious about how it ended up playing out. Okay, let's move on, Connie. We're getting near the end of these.
Okay, the next request is for overhead cost adjustments. Every year in the fourth quarter, we bring a supplemental request with a few adjustments to budget for the county overhead costs. We prepare a cost allocation plan every year, and this takes all of the costs of internal services like finance and HR, IT, facilities, county manager, and so on, and calculates how much of that cost is spent on each and every department and fund in the county. We then charge out to the special revenue funds, the enterprise funds, and the internal services funds the amount of that overhead. It reimburses the general fund for all of the services that internally we provide to these other funds. When we do the budgeting, we try to anticipate any changes that may be happening, but there can be some larger swings in those overhead costs year to year. So this is just a cleanup supplemental request to adjust the budget in a couple of funds. Any questions?
I think we're good.
Okay. Okay, we are down to the last request. This is in the public safety radio budget, And there are a number of changes in this fund. Jeff Kruger should be on the line. Jeff, thank you for hanging in there with us to the very end.
No problem. Yeah, thanks, Connie. Yeah, good afternoon, everyone. My name is Jeff Kruger. I'm the Telecommunications Department Manager. Supplemental request is for the Public Safety Radio Fund. And the request is really twofold. One has to do with the Route I site build. And the Route I site build, we actually had contributing partners that included Roaring Fork Fire, it included Roaring Fork School District, it included Eagle County. And it turns out we received payment from Roaring Fork Fire in 2019, but we didn't actually reduce the budget this year to reflect that. Thank you, Roaring Fork Fire, for paying early, which was very thoughtful of them. But the other two contributing partners were Roaring Fork School District and Eagle County. We've not received their payments for Route I yet. We anticipate those to be next year. In addition, one thing that really helps the budget overall is we've just learned that Eagle County is going to be paying an additional $26K on top of the $30K that they originally committed to. The second part of this is that we had, in my budget presentation in October, we were anticipating some savings in that budget on the Public Safety Radio Fund. Those savings did not materialize. We ended up having to do a DC power replacement at the Ajax Public Safety site at the top of Aspen Mountain, and professional services associated with that. And so that really ate up our anticipated cost savings that we were hoping to get in 2020. Another thing with this budget is it's now an enterprise fund, which started in 2019. So we really haven't had enough time to build up a reserve like we need to and we anticipate doing over the next few years. Is there any questions of me?
Don't see any, Jeff.
Thank you, Jeff.
Okay, great. Thank you, Jeff. So this is
Great, thank you all.
So this is the last of the supplemental requests today. Thank you, everyone, for hanging in there. I know that was a lot. These will be coming to you in first reading tomorrow on December 2nd.
We look forward to seeing you tomorrow.
Let's see, on the time. Next on our agenda, we have the review of the future agenda items. John?
Yeah, thanks, Steve. A few items for you. Just wanted to be sure everyone got the clarification on the time for the joint meeting today, which is 4 o'clock. I think at one point it was listed as 5 o'clock. So did everyone see that?
Yep.
Going really close to future agendas here. Okay. The other is we need to schedule a special meeting to approve mill levies as close to December 22nd as possible. And that's one that I think can be quickly done online. The issue is the board is responsible for certifying mill levies of other districts. So when you approve the budget, you'll be submitting a mill levy for the county, and then there's an administrative action of certifying the mill levies for all other districts in Pickens County. And I can't remember the date that they have to be submitted, but we need a little bit of time to prep those and turn them around for you. So we wanted to see, one, if December 22nd would work, or if there was another date between the 18th and 22nd, that would work. We prefer the 22nd to give us time to prepare.
Steve, the 22nd
And-
works for me.
Yeah, it works for me too. Good for George. Good for Kelly, good for Greg.
All right, we'll get something posted. I think it's gonna be a pretty quick item.
That was
Let's
easy.
see. And then the only other question that we had as staff, and if we need to push this to next week, that's fine, but Charlotte had distributed a draft meeting calendar for 2021, and just wanted to see if there are any changes or concerns with that. And if you're not ready, then that's your homework for the next meeting.
I'm not ready.
I didn't look, yeah.
If you all could take a look at that, and maybe next week, we just want to make sure that we've captured things as best we can this early. We know there will probably be some changes. And that's all I have for future agendas, Steve.
Patty,
Yeah, I've been looking at the calendar for next year, and it's hard to tell, but right now, I think everything looks good, looking at what we've scheduled. And as far as future agendas as a whole, there's not very many, so I don't have any changes or questions. Except, where's my 2021 Open Space and Trails calendar so I can put everything down on paper? It's coming, right?
I think so.
they just announced that it is coming.
Oh, yay.
Kelly,
Yeah, a couple of things. When's George's last meeting? I wanna know that. Not that I'm trying to get rid of you, George, but just wanna make sure we.
You make a
Should be
cake.
the second Tuesday in January.
Oh, I thought Charlotte said it was the first Tuesday, the second Tuesday?
I think you start in the morning, and then we do a handoff. That's how we've typically done it. So we usually start at 10. We have the swearing in and a reseating.
That's on a Tuesday?
It's the second Tuesday of the
I'll
month.
be there, I'll be there, Kelly, for a handout on a piece of cake.
Okay.
I knew we could get him here.
And then, looking to, gosh, when is it next? Sorry, the 8th. Looks like we might have a little time in the afternoon, so I wonder if we should schedule a longer COVID discussion if there are things in advance of the Board of Health meeting for that week. And alternatively, I think we need to find some time to revisit our legislative agenda, because we've done no outreach to our legislative, our to Rep. McCluskey and Senator Donovan. And so if our specific bills, which were not taken up by CCI, if we want to pursue those on our own, we should have that conversation and try to get on their radar a bit, because I think we're a little late to the game on that. So those would be my two suggestions for additional time that might be available.
Is there anything else from any of the other board members on future agendas? It sounds like I'm going to take everyone else's silence as agreement with Kelly to expand those two.
Maybe on the 8th, we can add a COVID conversation, and on the 15th, we can tag on a legislative conversation.
Yeah, and there may be some things that come up today also when we have our joint meeting, since that's going to be a COVID update also.
Yeah.
So,
Thanks.
Steve?
yeah, Patty,
Kelly, does that mean you want longer than the 30 minutes that's already scheduled for COVID on the 8th? Okay. The other question I have, are we going to have a discretionary fund balance discussion at some point before the end of the year? Because I know George is always wondering how he can spend the rest of our money.
Yeah, and we usually do that towards the end of the year, so on the last meetings, Patty.
Okay,
When we, see, make sure you don't have any requests that come in.
okay, just want to make sure we get that done.
Yeah.
Well, John, it's not really a future agenda item, but is there going to be a virtual Christmas party for the staff and their families this year, some fashion of that?
We actually replaced that with the gift of the fleeceware. So we're using some of the Christmas or holiday, I should say, holiday party funding for that. We found that the virtual get-togethers may not energize folks quite as much.
But John, Steve, can I add? John, are we doing books
Yeah.
are we doing books? You know, the parents always love that as part of the holiday party, was the books that went to kids. Do you know if the library is still thinking about doing that?
I do not believe so, Patty, but we can certainly look at that for. We usually use the registration for the Christmas or for the holiday party. I keep saying Christmas, holiday party, as a list for kids, the registration to do that. So we'd have to figure out another process.
Yeah, I would really like us to look into that. I think the parents and the kids we know always appreciate that, and it's just so valuable. And they always keep track of which kids get what books, so the next year they can up the ante to the right age level. And I think that's something maybe the library staff would look forward to doing. So I think that would be great, John. Thank you.
Let's see, we've got, we're scheduled for a break pretty soon, but maybe we could
Let's
just keep going and then do our break between our meeting and the city council meeting. So board open discussion items.
Yeah, so I had emailed a letter that was issued by the mayor's caucus on the Front Range to the governor's office. And the gist of the letter really was a request to the governor's office that as counties meet the metric requirements for certain levels in the coronameter, that those requirements are applied equitably and consistently. I think the consistency was really the big issue there, and I know it's a issue that at the staff level we've certainly struggled with. I think as we've talked to the Board of Health and our community and this board in the past, that's been an area where we've struggled. I thought that this was a well-written letter and expressed some of the concerns that I've heard this board express. I think it's more appropriate to have elected officials make this type of advocacy versus just an appointed board like the Board of Health. And so I wanted to put that in front of the board and just see if there's any interest in a similar letter coming from the Board of County Commissioners, or if that's still a concern with y'all.
Yeah, no, I thought that was a great letter, and there were a lot of great points that we're struggling with here, given in the Roaring Fork Valley, where we have 3 different counties, and different counties have different perspectives of what they should be doing. But my question is, would we, similar to the mayoral letters, would we try to get as many counties as feasible to sign on as well?
Well, we could either go with counties or tap our municipal partners here if the board is interested. I think There are probably, Kelly or Steve, I don't know if CCAT might be an entity that would be interested in a similar kind of letter. I don't think all the counties in our valley will necessarily sign on.
No, I understand that, but it seems like, and I think municipal partners, but if we can get counties to sign on, I think that adds credence to our concerns. And those who don't want to sign on, obviously, they're the problems.
Yeah. So,
John, can I?
Sorry.
Can I jump in on that? Kelly also asked me for a copy when we had the Board of Health letter that we're going to send to the governor, and I just keep seeing all these iterations of letters. I think this would be a more appropriate letter to bring forward to Northwest COG, probably to CCAT. So I agree with George, the letter was well written. I think we can take that letter as a template and create a letter in no time at all. And then I think we should rally our resources on the western slope to try and get as many things, because most of these mayors were Front Range, obviously. But I think we need to show that, we have the same issues over here on this side of the mountain. So I think that's key for us getting it done as quickly. I know everybody's got a lot on their plate, but we need to turn it around as quickly as possible, because those next metrics are looming ahead of us, and I think we need to get ahead of it.
Greg, then Kelly.
Yeah, hi. I certainly support sending a letter like that. It did occur to me to ask, what do we really anticipate the response or the outcome will be? and I'm not really sure. I'm skeptical that we're going to get anywhere. I know that the governor is under an awful lot of pressure right now. He's got counties and municipalities who are rebelling, and they have a diametrically opposed approach than we do. And I'm just wondering, it's like the definition of insanity. We keep sending a letter and expecting a different response, and we're not going to get a different response. That's my fear. That said, I'd say, yeah, let's do this. But do we need to be lobbying other counties and municipalities on the western slope to try to bring them along, and certainly people in our valley? Is there any point to that? Or should we be doing something else other than just sending a missive to the governor?
Kelly?
Yeah, I would just say, I think the timing is good. The legislature is sending a pretty clear message that access to funding will rely on counties, adhering to the orders and restrictions on the dial of where they're at. So it makes sense to me to reinforce that, okay, well, let's make sure that we're all at the same, that the dial is being applied equitably. If you're now saying that access to the funding has to be, garnered equitably. So I do think that the situation maybe is a little bit changed, because the legislature is sort of also sending that related message. The timing is good for this. I'm happy to elevate it to CCAT. They're, pretty active. There's already some CCAT members that have signed on to the mayor's letter, since they're, city, county structures. So that's easy enough to do once we have something final.
And Greg, to your point, I think other routes of advocacy that the board is, willing to pursue are also appropriate. I agree that a letter doesn't always get it done. Timing is good right now, as Kelly pointed out, and so that's why we brought it forward. But I don't think it's necessarily the only thing that you could be doing as a board if you wanted to pursue other advocacy or direct contact.
Well, and I just think it's the right thing to do. It's wholly unfair that Garfield County's businesses are not being subject to the same restrictions that ours are. With the way that people cross boundaries, with I think our shared economy is I just think it's also the right thing for us to be doing as well.
Okay, I think I've got direction there. That's all I had for, We have prep for the open space and trails meeting. I think we may have missed getting an open space and trails representative here. So I'm finding myself a little unprepared for it, but we could have a conversation, you know, if there are particular items that the board wants to be sure are addressed in the joint meeting coming up. Or you can go with our typical agenda where we set it with staff with open space and trails.
Okay, Steve, I have 2 issues, though, if we're done with open space. Steve, you're on mute.
You're muted.
Yeah, I just want the board to know I received a letter from Bob Oxenberg this morning, an email. The mosquito district in the East End has to do their 5-year permit with the Forest Service to do mosquito control. This is a big issue for us, and with the winter, I think the mosquitoes are probably frozen right now. But I just want to get the staff's nod, and I will work with Kurt Dahl and Charlotte to see, because we've done this in the past. So I'm hoping the board will support us doing it again, and I'll have Kurt draft a letter for us for signature. I think the signature from BOCC would have a lot of holding with the Forest Service. So if it's okay with the board, I can work on that. I don't see a lot of enthusiasm here to save the mosquitoes.
Patty, Steve, I'm just wondering, does open space weigh in on that, or Healthy Rivers? Do we have any other, you know, who are all involved in that advocacy?
Well, I think the permit issue is just for mosquito control on Forest Service lands. I don't know how they go through mosquito control on the open space, North Star open space, but I can check with Gary Tannenbaum to see how that works. And I'll get back to you on that, Greg.
It'd be nice to, I'd love to learn more about that. I've, of course, known about it for many years, and it's just interesting to know how that whole program works. And
I can tell you the one year they didn't do it, those mosquitoes would pick my daughter up and move her around in the backyard. They were huge, and they were everywhere in the East End. So, and they use a special mosquito control that is, you know, safe for the fisheries, etc. But I'll check with Gary or with Kurt Dahl when we work on that letter.
That'd be great to learn a little bit more. Thanks.
The other issue I have was the Saturday explosion at Smuggler Mine. Having a lot of history with the mine since it is part of Superfund, I had some concerns with mine safety, with public safety. Looks like the fire district took, the fire marshal, Parker Lathrop took, you know, he's the lead person on this issue. They're bringing in the state to review the mine. I asked John Peacock if we couldn't find a way to make sure the county stays in the loop, because it is county property. ComDev is responsible for issuing mining permits at our local level. I checked with John Ely on that. So John Peacock, I don't know who would be the best person if we touch base with somebody in ComDev, have them work with Parker maybe, or if you want to take that ball. I just think we need to make sure that we're protecting public safety in that section, since we own the land above it and around it and the road.
Yeah, so I've already got, I've notified ComDev and the attorney's office, and I have not reached out to Parker yet.
Okay, so when we get that all together, we'll have Parker just keep the county in the loop. Thank you.
John or Patty, is there actually a report that details what actually happened up there?
They're working on it, I think, as we speak. The state was supposed to, I think, be up there today, but we'll see.
Got it. Okay, so we'll find out what actually transpired, because I have a long history with the Smuggler Mine also. When we were kids, of course, we would blow things up there. You know, you find something and you detonate it, right? And so that would happen. And so when it happened in the last, 30 years, it was fairly common, but it's been so long but it didn't seem like this was a recreational thing with miners having fun like they would on the 4th of July.
Well,
So I'm concerned about it.
Yeah, they were apparently doing normal mining operations and something went awry. I don't know. It was significant, Greg, bigger than any 4th of July blast. It was very significant, and it could have been big kids up there messing around, but I think they were following protocols. My concern is to make sure that we have structural integrity within the mine shaft as best we can, because they do public tours there, and because it sits right above significant housing, and there's a significant amount of water within that mine, which I think is too low. The shafts where the water is too low to have been impacted, but I think it's something we just need to be cautious about.
Right, and I guess maybe some fire danger on the surface as well.
Yeah, with those plumes of smoke and fire there. The article was pretty explicit about that this morning in the newspaper. Thank you.
Hey, John, what are we talking about with the city? We never really saw a finished agenda.
Yeah, it's not, basically, we were asked at the staff level, and I got clarity on it yesterday, to provide a COVID update. So it's going to be a lot like what I provide for you all on a weekly basis. Today, going to just clarify how the state dial works, the changes in the public health order, what Orange Plus means, update on testing, as we've had new testing sites come online today, actually. And they're a little bit more out of the loop on what's happening in 2021. So talking about that, we have information about vaccination planning, and so we're going to go over that, talk a little bit about some of our communications, just other issues hanging out there, and really open it up for discussion. I don't know that there's decision points. One of the things that you all talked about last time you were together was winter planning and business assistance. I think, there's probably still some conversation to, have around that, even though right now I think we're still waiting to see where the legislature lands, how our CARES Act dollars come back in, and what flexibility you have. But it might be worth having some discussions on principle about, how you all would like to be able to approach those questions going forward. We'll talk a little bit about some of our communications campaigns coming up and really see where you all want to go with it.
Okay.
From there. So I've been prepping a presentation. I'll have about 15 slides. So, that usually takes me about 2 hours.
That's what I was going to remind John, after all he just told George we were talking about. This is a 2-hour meeting, and I do have to leave at 6 o'clock. So John just listed about 5 hours worth of information, George. So the 4 of you who are going to still be here plan to have dinner and watch the meeting.
It's even worse because I talk so slowly.
Hey, John. I've had a few people who are talking about what are the test requirements for Hawaii. I know somebody who was planning to go to Hawaii sometime in December, if everything, and turns out they don't offer the test here that Hawaii requires. And I'm wondering if there's a certain type of test that just isn't offered anywhere near our Western Slope, even at Vail or Grand Junction or Aspen. It seems like there's some other type of test out there that some states are requiring, and we don't offer it here. Do you know about that? I'm trying to understand
I've never heard of that.
I don't, Greg. I do know. I think I've heard some of the same things, that people have gotten there with their test results, and then the test results have been rejected. I have not looked at that, so I can't really answer it. I'd be surprised though if it's, if they don't accept a PCR test. I don't know exactly what they'd be looking for.
It's the coconut test.
Yeah, so sorry, I can't answer that one.
Okay, I'll see if I can learn any more about it. I guess the hospitals had requests from people for a specific type of test that just doesn't seem to be available. I'm just wondering if that's going to be a problem down the road.
Gosh, I don't know.
I guess we'll find out if that's true or what it means.
Greg, I have a friend who was there not too long ago. I'll check with them and see what they might know for you.
It looks like it might be called an NAAT, nucleic acid amplification testing. I don't know if that's different. If that's a different type of test. Anyway, we'll hear about it, I guess, if it's an issue.
Well, John, looking at the open space and trails meeting, a couple of things I think would be appropriate for a December meeting with them would be celebrating the accomplishments of this year, and looking at the bond issue money and how that will be anticipated, with upcoming projects. What's the strategy for using the bond issue? Also, I'd like to have a update on what's happening at North Star Management Plan and also the Crystal Bike Trail Management Plan. Kind of the big efforts that they've had a lot of staff working on, and what's happening with both of those. Those are things I would like to learn about. George?
Yeah, I mean, the only thing I would say, Steve, is that I don't think we should be, I know we never discuss sort of projects that Open Space is working on in terms of how bond dollars may be used, because negotiations are always going on and we don't want to air that in public, so.
Well, that part I was thinking of would be an executive session part of when we meet with them. Anybody else, anything on the meeting with Open Space and Trails? So are there any other open discussion items?
I see Rich and Phyllis are on. I just want to make sure they don't have any open discussion items.
I don't have any.
Good.
We just appear.
All right, I think, Steve, we're probably done. You should have the link. The city is hosting, so it's going to be a WebEx link, and that starts at 4 o'clock.
So, John, is it going to also be on Grassroots? You're covering
I believe it is, yes.
All right, so I'll just stay right here. No?
Okay.
It's happening at City Hall?
So we'll stay on this link then, okay.
I'll go upstairs. I got it.
No, you don't.
There's a different link that Sharp sent to you.
Yeah,
Yeah,
but,
it should be a WebEx link, Greg.
but so there will be nobody live here because they're going to film Grassroots from City Hall, and I doubt there will be anybody in City Hall sitting there, so it'll all be this new web, whatever it is that I think I now have, but we will find out.
All right, well, I'm in the building if you need help, Patty.
I know, and you all ran out of batteries the last time we tried that. All right, so we'll see you guys at 4 o'clock.
Okay.
You all for thanks.
Bye.
Grassroots, thank you.
Thank you, Mike.
For doing that.
Thanks. So.
There, we'll see you all at 4.